Hello there. Happy Thursday. I wanted to hop in for a quick live today to talk about an article that I just reread about functional neurologic disorders and the brain network changes that occur, particularly in kids and adolescents. But I think there's a lot to be learned about FND from this particular article. So thanks for hopping in here with me. If we haven't met, my name is Julie Hirschberg. I'm a neurologic physical therapist. I own and run Re+active Therapy and Wellness, which is a neuro rehab center. We work with a lot of folks with FND, but mostly I'm just curious about the brain, curious about neurologic disorders and chronic disease, and that's why I'm coming to you today. And actually, I have to give a big shout out to my colleagues at Mass General Hospital in Boston, because we are working, so Heather Salon, Julie Maggio, and myself, we're working on a CSM presentation. This is an annual physical therapy conference, and we're presenting on functional neurologic disorders and talking a lot about the neuroscience and brain changes. And this article came up again because we were talking about some of the networks in the brain that have been highly implicated in a lot of different disorders. But these come up in this study. So I want to start by talking about these two networks. And that is, one is called the default mode network, and the other is called the salience network. And a lot of my neuro nerd friends have heard these terms. I like to think of the default mode network as like literally the default mode. This is the part of your brain that's kind of monitoring things, monitoring the environment, considering what's going to happen in the future. It also directs attention to the self. So if you're one of those clinicians like me, kind of obsessed with FND, then you know that attentional focus is a component of the disorder. So the default mode network, it makes sense that it would be implicated in that. Now, the other network that was studied in this particular study, actually there were a few networks looked at, was the salience network. So the salience network is more, and when I say network, this is a network of multiple connected areas in the brain. The salience network is more of a bottom-up processor, and what they're doing is deciding what is salient. So they're paying attention to salient stimuli. And this becomes really important in a lot of neurologic disorders, switching focus between internally directed, which is our default mode network, and externally directed, which comes more from a central executive network of the brain. I hope I'm not losing you with all of this neuroscience. I know it's a lot, and I promise we'll hop into the study, but I think it was just important to know what these brain networks are, because this is why they did this study. So let me hop into this study. I'm going to give you the name here. I have it up. So this study was from 2018. It's called Motoring in Idle, a really great term. The default mode and somatomotor networks are overactive in children and adolescents with functional neurologic disorder. The first author is Kozlowska, a really wonderful researcher and clinician based out of Australia. And the group of folks come from all over the world that put together this article. And again, it was from 2018, and it's in Neuroimage Clinical. And by the way, if you're on our newsletter, I'll send the link out to the study. If you're not, hop on there, clinicians at reactiveeducation.com and patients at reactivept.com, patients or family members. I'll send the link to this. So what did they do here? So I like to talk a little bit about the what first. So what they were interested in doing is looking at brain network changes, comparing kids and adolescents with FND to healthy controls. And I've talked about other studies that have done this as well. A lot of studies have done functional MRI to look at this, and this study used EEG. Now, I am not a researcher in the field of EEG or fMRI for that matter. And so when I look at their methods, I had to look up exactly what they were doing. I don't fully understand it all as far as the actual testing that's done on an EEG. So you'll have to just take my word for it. I'm not going to be able to explain all of what they did. But in an EEG study, it lends itself to looking at networks of activity. So that's what's kind of cool about doing that. And what they could do is they could look at 57 people. So 57 kids with FND and 57 controls. And they could compare the patterns in these different networks. And particularly when you're doing EEG, you're looking at different types of brain waves, and they could look at those patterns. And they were looking at the default mode network, the salience network, and the somatomotor network. And I want to talk a little bit about let me just kind of hit on the key points from this article. I really want to talk about how they define the kids with FND, which I think was really great. But just going through a few pieces of the background of why they did it. So I mentioned the default mode network as this kind of sitting in default, right? One of the functions of the default mode network is energy regulation. And if you have an FND or know somebody with FND or work with people with FND, you know that energy regulation is definitely impacted. High levels of fatigue, high levels of difficulty sustaining activity, whether that's physical or cognitive. This was one of the reasons they really wanted to look at it, because they're clinicians and they see these things. And so this was an important piece of the why for them. Also, there have been other studies in FND that show some of these areas as potential areas that might be overly active in FND. So, the other thing that they wanted to look at the default mode network and the salience network is because these are also activated by interoceptive signals. So interoception is that kind of feelings from inside the body versus exteroception is all those feelings of sight, hearing, touch, and so on outside the body. And again, as clinicians, they knew and understood that, again, interoception may be an area that is impaired in FND. So they wanted to look at these parts of the brain and the brain networks. And they also wanted to understand, was pain a piece of this? Because the default mode network and the salience network are activated by interoceptive signals of pain. So pain, anxiety, also autonomic arousal. So all of those things are being interpreted and processed at default mode network and salience network. So I hope you're getting some of the why are we talking about these crazy networks and all of these crazy names and all these different parts of the brain? Because these are things that we are seeing clinically and we really want to understand. Okay, so who did they see? So they had 57 children and adolescents. They were from 8.5 years old to 18 years old, with the mean about 13.5, I think. Now, they used, at the time in 2018, the DSM-4 criteria for the diagnosis of FND. However, what they did not include in that diagnostic criteria, so the DSM-4 included that there must be a psychologic stressor as part of the diagnosis. And what I love is that this group, I'll read it, they said, however, we did not adhere to the DSM-4 psychologic stressor criterion. Our previous research with children and adolescents had highlighted that the psychological stressor criterion was too narrow. Yes. So even back in 2018, they had found that there are kids that develop FND without ever having a psychological stressor. So thank you, team, for acknowledging that that is not required for diagnosis. And they did not require that for diagnosis in this study. Many kudos to them for recognizing it's beyond just a psychological diagnosis. Okay, so then what they did was a resting EEG. So resting meaning the person's in a resting state, eyes open, and then they have an EEG cap reading all of these brain waves. And then what they were looking for are differences between the kids with FND, and they had 57 age-matched controls that were within 6 months of age, so very closely age-matched controls that they did this on. Really awesome. So what did they find, right? This is where it gets really interesting. So the kids with FND did have changes associated with the default mode network. So changes in the brain waves in those areas. And so those particularly they found in, I brought my brain, the dorsal medial, so dorsal, more medial, prefrontal, this is our frontal lobe, prefrontal cortex. This is part of the default mode network, as well as posteriorly and the posterior cingulate cortex and the lateral parietal cortex. That's in this area of the brain. So this is not just one area of the brain, because when we're talking about networks, we're talking about signaling between areas of the brain. So they actually had excessive activation in the default mode network areas of the brain, and in some of those somatosensory motor areas, like the supplemental motor area and the premotor area. Excessively active, overly active. This probably isn't surprising to you if you're a clinician or if you're a person with FND. These parts of the brain might be overactive. And what that means is you may not have voluntary control of your movement. So the other thing that they looked at, so I told you they looked at the salience network. They didn't have a significant finding. So, in research studies, you kind of a priori set a significance level for something to reach significance. And the salience network changes did not reach significance. And so they said they trended towards significance, but still not significant. They also found that a person's overall pain and their arousal levels also contributed to changes in these brain networks. So how do we interpret this then, right? So what do we do with this information? If a person has an overly active default mode network or somatomotor areas, these are areas that we see in FND all of the time. Energy regulation may be off, right? So we see that all of the time. The ability to prepare to make movement may be impaired. A person's overall arousal level and their vigilance and threat detection also would be on overdrive. Now, with higher activity in these areas. Now, of course, they, as one does is a research study in the discussion section, would be like, why might those changes occur? Some of it could be developmental or genetic, right? Some can occur, and they actually talk about this, and we see this a lot. They can occur in the person that has a physical injury or a medical condition. Those types of things happening in kids or adults, frankly, would actually purposefully, the brain would purposefully overactivate some of these areas of the brain to protect you. You become more vigilant. You may change how you are interpreting some of your interoceptive signals because you had a physical injury, or you were hospitalized, you had an infection, you had a tumor, what any of those pieces. And I love that the authors actually spend time in the discussion to talk about these physical and medical illnesses activate, and sometimes this sustained activation can be part of what the brain changes occur, because we do absolutely positively see that. So they also talk about a child, if they're exposed to a sudden uncontrollable stressor. And so we think about kids in a war zone, for example, or a family illness or death that may also make the same brain changes and adjustments that a physical or medical illness might also make. And it's that in that child's brain, instead of recovering from that, they might actually stay in that zone of vigilance and a high stress response. And that might be the implication of these changes in the default mode network, particularly, as well as the somatomotor networks that they found in this EEG study. There was one particular piece that I really loved, and I highlighted it in here for you. And what they say in this discussion, so I'll read it to you. Our data suggests that child and adolescents, remember this was just in child and adolescent patients with FND, increased activation of the brain at rest in these electrode clusters, that's how they call them in the EEG, that correspond to the default mode network and the salience network and the somatomotor network, marking a shift these are all at rest, in resting state functional brain organization. And I'll remind you, the default mode network is actually active at rest, but it was overly active in the kiddos with FND. The salience network is not active at rest. It is active with a threat or very emotionally salient stimuli. Should not be so overly active at rest. And then the somatomotor network, this is typically deactivated at rest, and instead of hyperactivated. So we've got 3 areas in the brain that are hyperactivated at rest that typically are not. And in fact, they compared these to kiddos that did not have FND and saw these differences, which I think is a really important part of this trial. Now, one thing, so this is important. This doesn't mean that if you put an EEG on every person with FND, they have this exact change, right? EEG1 is not a diagnostic tool in functional neurologic disorders, although I will say it is diagnostic in a person who has functional seizures. you can distinguish functional seizures from epileptic seizures with the EEG. So it's not as a diagnostic tool. It's not that we could diagnose somebody with FND just based on this hyperactivation pattern. And again, or that every single person with FND would have it. But it's a piece of a puzzle. And I actually think this is some of the earlier pieces. This is from 2018. There were definitely some things before that, but this was one of the pieces that helped propel the understanding of FND forward to be known as a brain network disorder. And seeing these distinct differences between kids with FND and kids without FND showed that specifically these brain networks related to attention, to self, to interoception, to activation and vigilance really are part of what might be causing FND. And as clinicians, then we can take this and go, okay, well, how can we then set somebody up in treatment if we know there is some hyperactivation in these particular networks? Can we change that activation pattern? And yes, we can. Now, I actually think it'd be pretty cool to have some EEG studies with treatment to see if we're changing it. Those haven't been done. So even though I say yes, we can, I haven't done the study to see if it's actually changing those brain networks. But my guess is it is, because people are able to regain control of their movement and regain control of their symptoms. So exciting stuff with understanding the brain and the brain network dysfunction in FND. And this leads us in our CSM talk, so our physical therapy conference coming up next month, by the way. If you're going to Boston, let me know. I would like to meet you in person at this conference. Our talk, let me get the actual title of our talk. So we're talking about functional neurologic disorders. The title of our talk is Motor Learning for Patients with Functional Neurologic Disorders is optimal, meaning the optimal theory, optimal in FND. And we're going to argue that it is. And it's because some of these studies showing the brain network changes that have occurred in areas that are related to attention, to safety, to interoception, that we would actually argue that some of the motor learning theories, like the optimal theory, lend itself very, very well to helping people with FND. So that's what we're going to talk about in our study, or in our talk at CSM next month. I'm really excited for it. If you're a clinician, if you're going to Boston in February for CSM, you'll have to join us for the talk. And I'm just going to scroll through here. Sometimes we'll get questions. As usual, you can send me questions anytime. Sometimes I lose things in my DM. Send them to me again if you don't hear from me. But send questions. And I just learned so much from the questions that you all have, and the things that you bring. I learn a lot from you. So thank you. And yes, Kaylee's going to be there. Come to the talk. Let's meet in person. To my fellow clinicians, I hope I see you in February in Boston at our conference. To all the wonderful people that I get to interact on here with FND or other neurologic disorders, keep the questions coming and get on our newsletter. I'll send out this video. I'll send out the link to the article. If you're a patient or family member, sign up at reactivept.com. And if you are a clinician, sign up at reactiveeducation.com. But hey, thanks for being here. Thanks for being curious about the brain with me. I appreciate you very much, and I will see you soon.